Sarah Martinez stared at the rejection email on her laptop screen, her coffee growing cold as the words blurred through her tears. 23 failed missions. 23 dreams crushed. 23 times she had believed this would be the breakthrough that would save her dying father, and prove to the world that she wasn't just another dreamer chasing impossible goals. But what Sarah didn't know was that failure number 24 would become the door to the most extraordinary discovery of the 21st century. A discovery so powerful, it would not only save her father's life, but revolutionize medicine forever. Sometimes the greatest victories come disguised as our most devastating defeats. This is the true story of how one woman's relentless pursuit of the impossible led to a breakthrough that no one saw coming. Sarah Martinez had always been the type of person who believed that if you worked hard enough, cared deeply enough, and never gave up, you could move mountains. Growing up in a small town in Colorado, she watched her father Miguel work double shifts at the local factory while pursuing his dream of becoming an inventor in his spare time. He would spend hours in their garage, surrounded by scattered papers filled with sketches and calculations, always working on the next big idea that would change their lives. When Sarah was 12 years old, her father showed her something that would shape the rest of her life. It was a small device he had been working on for months, something he called a bioscanner. He explained that it could potentially detect diseases in plants before they became visible to the human eye. With trembling hands, he demonstrated how it worked on their tomato plants, and sure enough, it identified a disease that wouldn't show symptoms for another 2 weeks. "Sarah, mija," he said, his eyes bright with possibility. "Imagine if we could do this for people. Imagine if we could catch cancer or other diseases before they spread, when they're still small enough to fight." That moment planted a seed in Sarah's mind that would grow into an obsession that would define her entire adult life. But life has a way of testing our deepest commitments. When Sarah was 16, her father was diagnosed with a rare form of lung cancer. The doctors said that if they had caught it earlier, his chances would have been much better. The irony was crushing. Here was a man who had spent years trying to create early detection technology, and his own disease had gone unnoticed until it was almost too late. The treatments were brutal and expensive. Sarah watched her strong, optimistic father become a shadow of himself as chemotherapy ravaged his body. She made a promise to herself and to him that she would continue his work. She would find a way to make early disease detection not just possible, but accessible to everyone, especially people like her family who couldn't afford expensive medical tests. Sarah threw herself into her studies with an intensity that worried her friends and family. She graduated as valedictorian and earned a full scholarship to study biomedical engineering at Stanford University. But even as she excelled academically, she felt the weight of time pressing down on her. Her father's cancer kept returning, and each relapse was worse than the last. During her sophomore year, Sarah began her first real attempt at creating a breakthrough. She spent every free moment in the lab working on a handheld device that could analyze breath samples to detect early-stage cancer. She called it Project Hope. And she truly believed it would be the answer to everything. For months she refined the technology, running test after test. The preliminary results were promising. When she finally felt ready, she applied for a grant from the National Science Foundation. She poured her heart into the application, explaining not just the science, but the personal story behind it. She was certain this was her moment. The rejection came on a Tuesday morning. The reviewers said her approach was interesting but lacked sufficient clinical validation and scalability. Sarah read those words over and over, feeling like someone had punched her in the stomach. This wasn't just a professional setback. It felt like a personal failure to her father and everyone else who was fighting diseases that could be caught earlier. But Sarah wasn't the type to give up easily. She went back to the drawing board, literally and figuratively. Maybe breath analysis wasn't the right approach. She pivoted to saliva testing, spending another 6 months developing a new prototype. This time, she partnered with a local clinic to get real patient samples for testing. The results were even more promising than her first attempt. She applied for funding from 3 different sources this time, convinced that casting a wider net would improve her chances. 3 rejections came back within 2 weeks of each other. The feedback was similar each time. Promising research, but not ready for real-world application. Sarah's friends started to worry about her. She was sleeping only 4 hours a night, living on coffee and determination. Her grades, which had always been perfect, started to slip as she devoted more and more time to her research. Her professors advised her to focus on her coursework and wait until graduate school to pursue such ambitious projects. But Sarah couldn't wait. Every day that passed was another day that people like her father were fighting battles that might have been avoided with earlier detection. She switched her focus again, this time to blood analysis. using a new type of sensor she had read about in a research paper from Germany. The third attempt took 8 months to develop. Sarah taught herself advanced chemistry and borrowed equipment from multiple labs across campus. She even started selling her belongings to fund the research when her part-time job wasn't enough to cover the costs of materials. This time, she was sure she had cracked it. The device could identify cancer markers in blood samples with accuracy that rivaled tests that cost thousands of dollars. She documented everything meticulously, created detailed presentations, and even built a working prototype that looked professional enough to impress investors. The rejection for her third attempt came with more detailed feedback, which somehow made it worse. The reviewer acknowledged that her work showed significant promise, but noted that she lacked the business experience and established research credentials necessary for such a large grant.
They suggested she gain more experience working with established researchers before attempting such ambitious independent projects.
Sarah felt like she was stuck in an impossible situation. She needed funding to prove her concept, but she needed to prove her concept to get funding. Meanwhile, her father's condition was deteriorating. The treatments that had helped him for years were becoming less effective and the doctors were running out of options. During her junior year, Sarah tried a different approach. Instead of applying for large grants, she focused on smaller competitions and started trying to attract private investors. She entered every science competition she could find, presented at undergraduate research conferences, and even started a blog to document her work and build credibility. The response was always the same: interesting work, promising concept, but not quite ready yet. Some investors were intrigued but wanted to see clinical trials. Some competitions recognized her dedication but awarded prizes to projects with more immediate applications. By the time Sarah reached her senior year, she had attempted 17 different variations of her early detection technology. Some focused on different diseases, some used different biological samples, and some employed entirely different detection methods. Each attempt taught her something new, but none of them achieved the breakthrough she desperately needed. Her 18th attempt was the most sophisticated yet. She had learned from every previous failure and incorporated feedback from dozens of experts she had consulted over the years. The device was smaller, more accurate, and designed with manufacturing and distribution in mind. She was certain this was the one that would finally work. The rejection came faster than usual this time. Just 3 days after she submitted her application, the investor's response was brief and devastating. While we appreciate your persistence and acknowledge your technical skills, we have concerns about the commercial viability of this approach in the current market environment. Sarah sat in her dorm room that night, surrounded by years of research notes, prototypes, and rejection letters. She felt like she was failing everyone who was counting on her, especially her father. The weight of 18 failures pressed down on her like a physical force. But something inside Sarah wouldn't let her quit. Maybe it was her father's example of never giving up on his dreams. Or maybe it was the knowledge that somewhere out there, people were suffering from diseases that could be detected earlier, if only someone could figure out how. She took a deep breath, cleared her desk of all her previous work, and opened a fresh notebook. On the first page, she wrote, "Attempt 19 inches," and began sketching new ideas. She didn't know it then, but she was about to embark on a journey that would test her resolve more than ever before, while also setting the stage for the discovery that would change everything. After graduating from Stanford with honors despite her struggles, Sarah faced a choice that would define the next chapter of her life. She had multiple job offers from prestigious biotech companies, each promising good money and the chance to work on cutting-edge research with established teams. Her student loans were mounting, and her family needed financial support for her father's ongoing treatment. But taking a traditional job felt like giving up on her mission. Sarah made a decision that seemed crazy to everyone around her. She turned down all the job offers and moved back home to Colorado. She converted her father's garage into a makeshift laboratory, using the money she had saved from her part-time jobs to buy basic equipment. Her 19th attempt was born from desperation and determination in equal measure. Sarah had noticed something interesting during her previous research that she hadn't fully explored. When testing blood samples, she observed that certain proteins behave differently under specific electromagnetic frequencies. Most researchers would have dismissed this as an anomaly, but Sarah decided to investigate further. Working 18-hour days in the garage, she developed a device that used electromagnetic pulses to analyze protein structures in blood samples. The theory was that cancerous cells would create proteins with slightly different electromagnetic signatures than healthy cells. If she could detect these differences, she could identify cancer in its earliest stages. The work was exhausting and isolating. Sarah's former classmates were starting their careers at major companies, posting photos of their new offices and exciting projects on social media. Meanwhile, Sarah was living with her parents, working alone in a garage, and watching her savings dwindle with each passing month. Her father tried to convince her to take one of the job offers she had declined, but Sarah could see in his eyes that he was proud of her dedication. He would often sit in the garage with her in the evenings, asking questions about her work and sharing stories about his own years of tinkering with inventions that never quite materialized. The 20th attempt took 6 months to complete. Sarah managed to create a working prototype that showed promising results in initial tests. She reached out to her former professors, hoping they might help her connect with someone who could provide the resources for proper clinical trials. Dr. Elizabeth Chen, her former bioengineering professor, agreed to review Sarah's work. After examining her research and testing the prototype herself, Dr. Chen was impressed but concerned. "Tara, this is brilliant work," she said during a video call. "But you need proper laboratory conditions, access to real patient samples, and a team of researchers. What you're trying to do alone in your garage would typically require a team of 20 people and millions of dollars in funding." Despite Dr. Rutai Chen's encouragement to join an established research team, Sarah felt more determined than ever to continue independently. She had invested too much time and energy to hand her work over to someone else. She applied for every grant, fellowship, and research opportunity she could find, but the responses were becoming predictable. Impressive work, but not ready for funding without proper institutional support. The 21st attempt focused on making the device smaller and more user-friendly. Sarah taught herself advanced engineering and electronics, watching YouTube tutorials late into the night and ordering components with the last of her savings. She created a device the size of a smartphone that could supposedly detect early-stage cancer from a simple drop of blood. This time, she tried a different approach to funding. Instead of applying to traditional sources, she launched a crowdfunding campaign, sharing her story and her father's battle with cancer. The campaign gained some traction on social media, but it fell far short of her funding goal. Most people were supportive but skeptical that one person working alone could achieve what major research institutions hadn't accomplished. As months passed, Sarah's isolation grew deeper. Her college friends stopped reaching out as frequently, tired of her declining invitations to visit because she was always too busy with research. Her parents grew increasingly worried about her mental health and financial situation. Even her father, despite his continued support, gently suggested that maybe it was time to consider other options. The 22nd attempt was Sarah's most ambitious yet. She had been corresponding with researchers in Japan who were working on similar electromagnetic detection methods. Through months of email exchanges, she learned about new techniques that could potentially improve her device's accuracy. Sarah spent her entire remaining savings on advanced components and materials. She worked for 3 months straight, often forgetting to eat or sleep as she refined her design. When she finally completed the prototype, she was convinced she had achieved a breakthrough. The testing results were devastating. While the device showed some promising signs, it also produced too many false positives to be clinically useful. Sarah realized she had made a fundamental error in her calculations that invalidated months of work. That night, Sarah sat in the garage at 3 a.m, staring at the broken prototype and wondering if everyone had been right all along. Maybe she was just a stubborn dreamer who refused to accept reality. Maybe her father's illness had clouded her judgment and made her believe she could accomplish something that required resources and expertise she simply didn't have. But the next morning brought unexpected news that would reignite her determination. Chen called with an opportunity that seemed almost too good to be true. A former Stanford alumnus named Dr. Wal Pambert, Marcus Webb, who now ran a small biotech startup in California, had heard about Sarah's work through academic circles. He was interested in meeting with her to discuss a potential collaboration. Dr. Webb's company, Innovative Biosolutions, specialized in developing medical devices for underserved markets. Unlike the major pharmaceutical companies that focused on expensive treatments for wealthy patients, Dr. Webb was passionate about creating affordable healthcare solutions that could be used in developing countries or rural areas where advanced medical facilities weren't available. Sarah drove to California with her latest prototype, hoping this might be the break she had been waiting for. Dr. Webb was a soft-spoken man in his 50s who had left a lucrative position at a major pharmaceutical company to start his own venture focused on humanitarian applications of medical technology. After reviewing Sarah's work and testing her prototype, Dr. Webb was impressed by her dedication and innovative approach. However, he also delivered some hard truths that Sarah wasn't prepared to hear. "Your instincts about electromagnetic detection are sound," he told her, "but the execution needs significant refinement. More importantly, Even if we perfect the technology, getting it approved for medical use could take years and millions of dollars in clinical trials. Dr. Webb offered Sarah a position at his company, where she could continue her research with proper resources and support. But there was a catch. She would need to work as part of a team on multiple projects, not just her electromagnetic detection device. Her pet project would become one of several research priorities, and there was no guarantee it would ever reach the market. Sarah felt torn. This was exactly the kind of opportunity her professors had encouraged her to pursue, but it meant giving up the independence and control she had fought so hard to maintain. She asked for a week to consider the offer. During that week, Sarah's father had another medical emergency. His cancer had spread to his liver, and the doctor said his time was running out. As Sarah sat by his hospital bed, holding his hand and watching him struggle to breathe, she felt the weight of all her failures pressing down on her.
"Mia," her father whispered, his voice weak but determined. "I want you to know something important. You haven't failed."
Every attempt you've made has taught you something new. The greatest inventors in history failed hundreds of times before they succeeded. Your work will help people, maybe not in the way you originally imagined, but it will make a difference. Sarah made her decision that night. She would take the position with Dr. Webb's company, but she wouldn't give up on her original mission. She would learn everything she could about proper research methods, regulatory processes, and team collaboration. Then, when she was ready, she would return to her electromagnetic detection project with the knowledge and resources needed to succeed. The 23rd attempt was different from all the others because it wasn't really her attempt alone anymore.
Working with Dr.
Webb's team, Sarah contributed her electromagnetic detection research to a larger project focused on creating portable diagnostic devices for rural healthcare workers. The collaborative approach was both frustrating and enlightening for Sarah. She had to compromise on her vision and accept input from colleagues who sometimes disagreed with her methods. But she also learned valuable lessons about research methodology, quality control, and the complex process of bringing medical devices to market. After 6 months of intensive work, the team completed a prototype that incorporated some of Sarah's electromagnetic concepts into a broader diagnostic platform. The device showed promise, but when they applied for funding to begin clinical trials, they received familiar news. The technology wasn't ready for large-scale investment. Sarah felt the familiar sting of rejection, but this time it was different. She wasn't facing it alone, and she had gained insights that made her previous solo attempts seem almost naive in comparison. She understood now why so many brilliant ideas never made it from laboratory to marketplace. The technical challenges were only part of the equation. The regulatory, financial, and logistical hurdles were equally daunting. But Sarah also realized something else. Her failures hadn't been meaningless. Each rejected prototype had taught her something valuable about electromagnetic detection, biomarker identification, or device engineering. She had accumulated knowledge that no textbook could have provided. As her father's condition continued to worsen, Sarah made another difficult decision. She would leave Dr. Webb's company and make one final attempt on her own terms. But this time would be different. This time she would apply everything she had learned from 23 failures to create something truly revolutionary. Sarah returned to her parents' house in Colorado, but instead of setting up shop in the garage again, she rented a small laboratory space in town, using money she had saved from her salary. She also did something she had never done before. She started reaching out to other researchers who might be interested in collaborating on specific aspects of the project. The 24th attempt was beginning to take shape in Sarah's mind, but she had no idea it would lead to a discovery that would change not just her life, but the future of medical diagnosis itself. All she knew was that she wasn't ready to give up, and this time she would be better prepared than ever before. Sarah's father passed away on a quiet Tuesday morning in March, just as the Colorado snow was beginning to melt and reveal the first signs of spring. She was holding his hand when he took his last breath, and his final words to her were, "Promise me you won't stop believing in impossible things." The funeral was small but meaningful, attended by family, friends, and several former colleagues from the factory where Miguel had worked for over 30 years. As people shared stories about her father's kindness, work ethic, and unwavering optimism, Sarah felt a profound shift in her perspective. Her mission was no longer just about proving herself or achieving success. It had become about honoring her father's memory and helping other families avoid the pain she had experienced. 2 weeks after the funeral, Sarah returned to her small laboratory with a clarity of purpose she had never felt before. She had learned from Dr. Webb's team about the importance of collaboration, so she reached out to 3 researchers who had shown interest in her electromagnetic detection work over the years. Dr. Raj Patel, a biochemist at the University of Colorado, had been intrigued by Sarah's protein analysis research. Dr. Lisa Park, a materials engineer from Denver Tech, was interested in the device manufacturing challenges. Dr. Ahmed Hassan, a data scientist who had left academia to work as a freelance consultant, was fascinated by the pattern recognition algorithms needed to interpret the electromagnetic data. For the first time in her career, Sarah wasn't working alone. The team met twice a week in her laboratory, and each brought unique expertise that complemented Sarah's core research. Patel helped refine the biochemical analysis methods. Dr. Park worked on making the device components more durable and manufacturable. And Dr. Katie Hassan developed sophisticated algorithms to reduce false positives. The 24th attempt began with a fundamental insight that had emerged from Sarah's experience with Dr. Residentia, Webb's team. Instead of trying to create a single device that could detect all types of cancer, they decided to focus specifically on the type of lung cancer that had killed her father. By narrowing their scope, they could optimize every aspect of the detection process for maximum accuracy. Sarah had also learned something crucial from her previous failures: the importance of understanding not just what worked, but why it worked. She spent months reviewing research papers from around the world, looking for clues about the specific electromagnetic signatures of lung cancer proteins. During this research phase, Sarah discovered something that made her heart race with excitement. A team of researchers in Sweden had recently published a paper about quantum-level electromagnetic effects in protein structures. Their work wasn't related to medical diagnosis, but Sarah realized their findings could explain phenomena she had observed but never fully understood in her previous attempts. Working 18-hour days again, but this time with the support and input of her collaborators, Sarah began developing a new type of electromagnetic detection system based on quantum field interactions. The concept was so advanced that even she wasn't entirely sure it would work, but the theoretical foundation was solid. The breakthrough came on a rainy Thursday evening in late September. Sarah was alone in the laboratory, running tests on the latest prototype, while her collaborators attended a conference in Denver. She had drawn blood samples from herself and several volunteers to test the device's ability to distinguish between healthy and potentially problematic protein signatures. As she analyzed the electromagnetic readings from her own blood sample, Sarah noticed something strange. The device was detecting an anomaly that didn't match any of the cancer signatures she had been looking for. At first, she assumed it was a technical error, but repeated tests showed the same unusual pattern. Curious and slightly worried, Sarah ran additional tests using more sophisticated analysis software that Dr. Hassan had recently installed. The results were consistent. Her blood contained protein markers that indicated the very early stages of a cellular change that could eventually develop into cancer. Sarah's initial reaction was panic. After watching her father fight cancer for years, the possibility that she might be facing the same battle was terrifying. But as she calmed down and analyzed the data more carefully, she realized something extraordinary had happened. Her device hadn't just detected early-stage cancer. It had identified pre-cancerous cellular changes that were so early they wouldn't show up on traditional medical tests for months or even years. The electromagnetic signatures were revealing biological processes at a level of detail that no existing diagnostic technology could achieve. Sarah immediately called Dr. Patel, despite the late hour. When she explained what she had discovered, there was a long silence on the phone. "Sarah," Dr. Patel finally said, "if this is accurate, you haven't just created a better cancer detection device. You've potentially discovered a way to identify diseases before they actually become diseases." Over the next few days, Sarah's team worked around the clock to verify the results. They tested blood samples from dozens of volunteers, many of whom were patients at the local hospital who had agreed to participate in research studies. The device consistently identified patterns that corresponded to various stages of cellular health, from completely normal to actively cancerous, with several intermediate stages that had never been clearly defined before. Dr. Hassan's analysis software proved crucial in interpreting the complex electromagnetic data. He had developed algorithms that could identify subtle patterns in the quantum field measurements that human analysis would never detect. The software could not only identify abnormal protein signatures, but also predict with remarkable accuracy how those signatures might evolve over time. The implications were staggering. If Sarah's device could really detect diseases months or years before they became symptomatic, it could revolutionize preventive medicine. People could receive treatment when their cells were just beginning to become abnormal, long before those changes developed into serious illnesses. But Sarah knew that extraordinary claims required extraordinary evidence. She reached out to Dr. Chen, her former professor, and explained what they had discovered. Chen was initially skeptical, but when she reviewed the data and observed the device in operation, she became convinced that Sarah's team had achieved something genuinely revolutionary. Dr. Chen helped Sarah navigate the complex process of documenting their discovery for peer review. They spent months preparing research papers, creating detailed technical specifications, and conducting additional tests to verify their results. Every test confirmed what Sarah had first observed on that rainy Thursday evening. The device could detect biological changes at a level of sensitivity that surpassed existing medical technology by orders of magnitude. The first major validation came when a volunteer whose blood had shown early warning signs 6 months earlier was diagnosed with stage 1 lung cancer using traditional medical tests. The device had predicted the diagnosis half a year before. Conventional methods could detect the disease. Even more importantly, because the cancer had been caught so early, treatment was much more effective than it would have been later. News of Sarah's discovery began to spread through the scientific community. Researchers from major universities requested permission to replicate her experiments. Medical device companies started reaching out about potential partnerships. Investment firms that had rejected her previous applications suddenly wanted to discuss funding opportunities. But Sarah remained focused on the mission that had driven her from the beginning, making early disease detection accessible to people who needed it most. Instead of immediately pursuing the most lucrative offers, she established a foundation in her father's memory dedicated to developing affordable versions of the technology for underserved communities. The device, which Sarah named the Miguel scanner after her father, proved effective for detecting not just cancer, but early signs of diabetes, heart disease, and several autoimmune conditions. Each disease created unique electromagnetic signatures that Dr. Hassan's software could identify and track over time. Within 2 years of the initial discovery, Sarah's technology had completed preliminary clinical trials and received emergency approval from the FDA for cancer detection. The device was being manufactured by a partnership between Sarah's foundation and a major medical device company, with profits shared between advancing the technology and making it available in developing countries. Sarah often thought about the conversation she had with her father in his hospital room, when he told her that her failures would eventually lead to something meaningful. He had been right in ways that neither of them could have imagined. Each of her 23 failed attempts had taught her something essential about electromagnetic detection, protein analysis, or medical device development. Without those failures, she never would have had the knowledge and experience necessary to recognize the significance of what she discovered on that Thursday evening. The Miguel scanner became standard equipment in hospitals around the world within 5 years of its initial development. Early detection rates for cancer and other serious diseases improved dramatically, saving millions of lives and reducing healthcare costs globally. Sarah's technology had accomplished exactly what her father had dreamed of in their garage all those years ago. It caught diseases when they were still small enough to fight. Sarah continued her research, working on new applications for quantum electromagnetic field analysis in medical diagnosis. She established a research institute that brought together scientists from around the world to explore the intersection of physics and medicine. Her work opened entirely new fields of study and inspired a generation of researchers to think differently about the relationship between electromagnetic fields and biological processes. Years later, when Sarah received the Nobel Prize in Medicine for her contributions to early disease detection, she dedicated the award to her father and to everyone who had ever been told their ideas were impossible. In her acceptance speech, she said, "The greatest discoveries often come not from our successes, but from our willingness to learn from our failures and keep believing in impossible things." The story of Sarah Martinez and the Miguel scanner became a testament to the power of persistence, the value of collaboration, and the importance of never giving up on dreams that could change the world. Her 24 attempts had seemed like failures at the time, but each one had been a necessary step on the path to a discovery that would save countless lives. Sarah's father never lived to see his daughter's ultimate success, but his influence was evident in every aspect of her work. His belief in the impossible, his dedication to helping others, and his unwavering support had given Sarah the foundation she needed to achieve something truly extraordinary. The little girl who had once watched her father tinker with inventions in their garage had grown up to become one of the most important medical researchers of her generation. Her story proved that sometimes the most important breakthroughs come not from avoiding failure, but from learning how to fail forward. One attempt at a time, until you finally discover something that changes everything.